Hello, everyone. Let me take this opportunity to welcome you to our July call. Thank you so much for joining today's call. I also want to take this opportunity to appreciate our steering group for all the efforts you put in supporting the co-chairs and the coordinator to make things happen. We always appreciate you. My name is Mariam, and I'm the co-chair together with Gabriel Hunter. We lead the business of social behavior change in malaria prevention and control. I wish to welcome you to today's call. And as usual, our call is interpreted into English, French, and Portuguese. And please select your language for interpretation now. I know that by now we know that we can be able to click on interpretation, select your English, French, or Portuguese. After today's call, our slides will be shared to you. The recordings will also be shared by our coordinator as usual, and you'll be able to always follow what we discuss on those slides. If you haven't done the introduction, please, as you join the call, introduce yourselves into the chat, and we'll be able to know who is here. And I always see familiar faces. I can see there's familiar names in the chat. Thank you, everyone, for joining the call. Today, our discussion will definitely be shared with you. And as we have always done, you'll be able to follow. And you can also go into the chat. The slides are there. You can click in the chat to follow the slides in the 3 languages. Lastly, I wish to introduce to you today's agenda. Today, we are going to be giving you our updates as a working group. And then we shall also give a chance to our regional ambassadors to give us some updates. You know, we have those volunteers who are doing a lot of work in the countries and representing the lingual groups. They're going to give us some updates. And then we shall have a technical presentation on how social behavior change efforts helped Cabo Verde to achieve their malaria-free status. And we can always learn from that, especially the fact that we have stratified most of our strategic plans and we have regions of elimination. It will be nice for us to learn from them. And then after that, we shall have the question and answer session, followed by closing remarks. I wish to thank you so much. I see very many familiar faces. Thank you, team from Madagascar, Cote d'Ivoire, Uganda, Malawi. I can see many of you have joined the call. Thank you. And we always continue to give you quality SBC updates. Now I hand over to Ashley to lead us into the updates. Thank you.
Thank you so much, Miriam. Over the last few months, the membership was invited to nominate and vote for one open SBC working group co-chair seat. I am pleased to announce that Elizabeth Chiende of the Catholic Relief Services in Zambia was elected to serve as the working group co-chair for a 2-year term. Please join me in congratulating Elizabeth in the chat. Elizabeth will overlap with Miriam and Gabrielle, our current co-chairs, through October 2024, when the second co-chair seat opens for election. Miriam and Gabrielle will complete their terms at that time. Thank you all for your participation in this election process, and especially to the candidates who are willing to serve in this important role. An additional change, please join me in warmly welcoming April Monroe to the steering group. April is replacing Andy Tomset, PMI USA donor representative on the steering group. Welcome, April. Finally, have you marked your calendars yet for the 11th SBC Working Group annual meeting? This year, we will gather from September 11th to 13th in Nairobi. The annual meeting is an opportunity to convene malaria SBC professionals to share experiences in malaria SBC, participate in skills building workshops, set the working group's priority for the next year. And this year, we will also hold a joint forum discussion with the Malaria and Pregnancy Working Group. As always, interpretation will be provided in English, French, and Portuguese. Please stay tuned to the SBC Working Group email list, where I will share updates on registration, the venue, abstract acceptances, and more. Today, we will hear about the work of our Francophone and Lusophone ambassadors. As we all know, the SBC Working Group has held this important ambassador program for the last 4 years. The ambassadors do very important work in engaging their linguistic and regional groups to contribute to the working group. We wish to send a big thank you to the ambassadors, all of the ambassadors, Francophone and Lusophone, for your engagement. It is important for the SBC Working Group to hear about our ambassadors and hear from our ambassadors. So I will now pass the floor to Jean-Jacques, point of contact for our Francophone ambassadors, for updates from the Francophone ambassadors. Over to you, Jean-Jacques.
Thank you very much, Ashley. Thank you very much for giving me the floor. Today, I would like to give you some updates on the Francophone ambassadors. So they are volunteers that work from different countries. They come from different countries, Burkina, Madagascar, Benin, from Côte d'Ivoire, Cameroon, from Mali. So as you can see, we have a diverse pool of ambassadors. And if you want to follow us and join the group, you can use the QR code on the slides. So the WhatsApp group is a channel to be able to communicate as Francophones. Next one, please. So the ambassadors worked and created this WhatsApp group. So we created this WhatsApp group. And now we have 42 members to be able to facilitate communication among the Francophone group. The ambassadors in different countries promote everything about the SBC working group meetings, the technical gatherings, and they encourage everyone to participate in our different meetings. They also support on the technical aspects in the different countries. So they are a good support for our members. They include, for example, supporting NMPs, using the SBC working group templates and guidance for malaria SBC plans. They also support in the NMPs on drafting the annual meeting abstracts, the one, for example, that we are going to have in Kenya this year. All the ambassadors are actively engaged in malaria fight in the different countries. We have seen that the ambassadors have created different activities. For example, they hosted the World Malaria Day activities. They also hosted malaria shows and debates on different national TV channels in the different countries. They also support for monitoring and support of community-based organizations. So this is some of the work that these ambassadors are doing. And now I would like to give the floor to Sus Emiliano so that we can hear all about the Lusophone ambassadors updates. Thank you very much. Uh,
Em relação these actualizations is to show how we are increasing our members in our WhatsApp channel. We have already 50 people participating, 54 actually representing several countries of Lusophone, and also a national, provincial, district level, including partners, donors. It's a group very, very active. Once again, we are very happy to have the inclusion of several members of other Portuguese-speaking countries, such as São Tomé and Príncipe, Guinea-Bissau, and Cape Verde. As Jean-Jacques mentioned, the Francoff group, the Lusophone group will support to the PNCM in the preparation submission of abstracts as we try to get feedback of helping the control of malaria programs in several countries, ensuring that all the abstracts are presented. It's also the channel is sharing information and updates through newsletters, sharing photographs and other activities, so all of us know what is happening in terms of SBCs in several different geographical locations of the Lusophone. It's also a reminder from meetings and technical meetings of our working group, but also of other relevant meetings in Portuguese. For example, we had a webinar on the April 26th organized by Women in Global Health, and this channel was able so we could have the work for the elimination of malaria represented. So thank you, Sancho. There's been one of the ambassadors helping us. These channels, we also do dissemination of technical documents available in Portuguese, such as the Malaria SBC toolkits for community and religious leaders, and the toolkit for social and behavioral change against malaria for community health agents, and other materials. Of course, this channel is an exchange of experience in the design and implementation of activities, and organizing webinar that we're having today is an experience of in challenges. We have here Cape Verde that is tell us their program in order to obtain the malaria-free certification. Also, thank you to all ambassadors. Now we will move with a lot of excitement into the technical presentation. Today's topic is focused on how malaria SBC efforts helped Cape Verde to achieve malaria-free status. We know that this was recent, in February of this year by the World Health Organization. The presentation will be done in Portuguese. Please choose the language in which you want to listen to the simultaneous interpretation. And also we have the slides presented in English, French, and Portuguese, and the link that has already shared in the chat. Will present to you Dr. Dilson de Pina, responsible for the malaria elimination program in Cape Verde. Doutora Dilson, com a palavra. Doutora Dilson, he will tell us how the efforts SBC helped the country Cape Verde to achieve their certification malaria-free status. Thank you so much, Dr. Dilson, to accept our invitation. Welcome to our general call. I will give you the floor. You have around 10 to 15 minutes, and then we'll move forward to a question and answers session. The stage is yours, Dr. Adilson. Thank you, Suze. Thank you all. I'll just say that Cape Verde was certified as a malaria-free country in 2nd of January 2024. The certification was granted, as we know, by WHO. Can you see my screen? Yes. Yes, we can see it. Here, I would like to say as I said, Cape Verde was certified by WHO as malaria-free country, and that achievement is because of all the work that is done at community level with all the associations and several initiatives that we were implemented through time. There was a very robust political engagement. As we know, this is key for the elimination of malaria. What we know in the 80s, 3 years, it was not possible to achieve their certification. That experience was also helped us. We created a commission was responsible by the Prime Minister, and since 2017, the health policy had as a goal to elimination of malaria, and several strategic plans were developed since 2009 for the pre-elimination, then elimination. So 3 points were executed. Our goal was to achieve the community in terms of providing good quality, gender, and social inclusion. So these are also factors that were key in the process. In the last few years, we prepared here in Cape Verde what we call a strategic plan for the prevention of malaria after certification, which is now in the revision phase, trying to promote the regionalization and the complementation of all community health services. With this intersectoral coordination, with the promotion of with several actors that work, especially in the local chambers, environmental areas, other services that collaborate with us. This sanitary plan action includes the immunization of the population in several areas in order to make responsible try to eliminate all the infectious diseases through vectors in the schools, regarding specifically what malaria. In the last few years, our risk plan against malaria and other diseases, viral diseases, we have actions for the population, what we change behaviors, attitudes, which might have an impact in the fight and prevention of these diseases, also promoting MSC, so the country could, SBC actually, so the country could be free of malaria. In several protocols with the Journalists Association and Tourism Association, so trying to disseminate information so country could be, so all of them could help us. Several investments all the country, not necessarily direct investment, but when we think about malaria, we can see all the areas that might affect, including technological and humans as well, in terms of human resources, research, improvement and up-to-date in the health system, and the universalization of health service, specifically in the malaria, also contributing so that we can provide this service, as well the social service that provide this assistance to the population, including their surveillance, as these all were strategies that we had to implement. The investments, not only on the health, in sanitation, education, social movement, these are important factors. We know that 85% of the population of Cape Verde, they have a very high literacy rate. When we see adults, it's over 95%. The investments in life expectancy, access to clean water, sewage, sanitation, education, all are factors that are contributed. Other investments other than education was several campaigns implemented in the country since 2009, with the establishment of the elimination plan, the fight against vectors as well, which is not only for malaria, but also included all the vector mosquitoes are trying to prevent the other diseases. This is, but the country really believe that this will be able to help us, because we have a very part of the year that we have a lot of rain, and also environmental control that is being done. We also, the use of the nets, it's always done. We don't have any mass distribution campaigns, only done at the health hospitals, some community agencies, as also some immigration agencies, that they have this culture to use nets, and also the questions of environment, sanitation, especially in the region that we consider hotspots in terms of risk. Through the years, we've been monitoring all the information in several studies. We have 3 main studies about malaria in Cape Verde, one in 2016, the other one in 2023 that is being prepared. It's available to all. We are just sharing some data. We have an increase about the knowledge about malaria with the compare 2017 to 2023. We have 20% of the population that are very much aware of the transmission of malaria. We notice an increase of 17-23% of the population that is using the nets, and also the pulverization. There was an uptick, actually a reduction, a decline of 42 to 34%. We have other survey data. Also, the participation of this community, there was a reduction, and our forecast that this will be the main, the sharing of the population. We're using the social media and the television, and also the improvement of conditions of the malaria. We have some reference about some cities, and we're trying to follow up. So data, again, you can see in the city of Praia, which is one of the area for the reductions of malaria. We have campaigns that are being taken place with social media and also television, and also have campaigns door to door. We have the campaign saying malaria free starts with me. It's a commitment for all of them, and it's the message that we are trying to share. We also have international collaboration with WHO, the Global Fund, RBM, ALMA, also national university, international associations that help us with their research, and all these efforts in terms of SBC will helping us to reduction of malaria and help us achieve the malaria-free certification, with a great impact in our economic sector, because we have a very active tourism sector. These are some photographs of what are happening in the community, in some neighborhoods. Here we have Dr. Antonio, following the colleagues in local and field. You see that it's not easy, as you can see some images the city of Praia and other municipalities, area, very touristic areas, in contrast with some rural areas. We know this is not easy, but we got the engagement. And also they asked Susie to share our video. We are very, very grateful for the opportunity to share our ability, and we hope that in future we could share more our efforts and our achievement to have Cape Verde as a malaria-free country. Thank you so much. Thank you so much, Dr. Adilson. Ashley, can we share the video, please? Malaria-free commitment for all. We are not able to see the video with sound. Ashley, can we try again? Can we try again? Because the video came without sound.
Yes,
There's no sound.
moment.
We appreciate your patience because we are trying to overcome this technical issue because we love everybody to listen to the video.
Este é o relato de uma vitória de
This
todos,
is
porque é sós e juntos
This
batalhamos
is a
por isso.
story of
Da
all of
política ao
us,
social,
from
das
the
empresas às
political to the
comunidades,
social, from the
mantemos o pacto de intercâmbio que
business
perdura.
sector to the
De
community.
candidatos,
We have a
lutamos
pact
para a eliminação
fighting
do
for the
paludismo em Cabo
elimination
Verde.
of malaria
Conseguimos.
in Cape Verde,
Paludismo zero,
and we are able to
compromisso de
achieve
todos,
it.
meta
Malaria
de
free,
todos.
a commitment for all. Yeah, now we are able to listen to the video. Thank you so much, Ashley, to be able to resolve this technical issue. And Dr. Adilson, thank you so much for sharing the experience and the journey of Cape Verde to achieve the malaria-free certification. Was very interesting, the approach that we'll be able to share with us, and I'm sure our colleagues online will be able to appreciate it again. Thank you so much. Now we are gonna move forward to the question and answer session, and appreciate all the questions that we are putting on chat. Continue to do that so that we can have time for Dr. Adilson be able to answer some of your questions. The first question that we see here, the first question, in the activities of SBC, which is the one, or which was the role or the engagement of the religious leaders and communities? What are their role in Cape Verde? Thank you, Susie. Regarding not only the religious communities, NGOs, civil society, we always have that concern. And with the financial of the Global Fund, we have institutions working on the field. Religiously, communities as well, in several communities that we have, including the prime ministers and also the CCM that is part. We have religious leaders. With the Caritas from Cape Verde, they work closely with the population. These the one of that benefited from the Global Fund, and also in a transversal perspective, not only malaria as the other diseases that we mentioned, such as dengue. We know that the religious communities have been working together with us, not only in the community level, but also in the meetings and decision process as well. Thank you. Well, now we have another question that's coming from us, from Tatiana, that is asking us if you could talk a little bit more of the strategy adopted for certain populations, especially for those, the travelers and the pregnant women and young women. If you could elaborate a strategy. For the travelers, as I said before, we have an agreement with the tourist agencies of Cape Verde and also the INB, International Intergovernment Association. So the aircrafts, when arrive, they are pulverized, and all the aircrafts that also get out of Cape Verde is the same. When they land here, we don't have a strategy specifically for malaria, but we control all the travelers that arrive in Cape Verde, especially for malaria, but also including those concepts. Even before COVID-19, we had in our airports to control fever. In certain situations, we have the experience to detect malaria case in the airport. We have a medical team that able to select, especially flights coming from the endemic countries. We don't have any specific how to control in these entry ports. We have to use that. Another thing that we do together with the immigrant platforms, we try to create awareness specifically when to provide some surveillance and some alert. For the pregnant women, we don't have any specifically strategy. When we analyze the data, specifically in the last epidemic, in only 3 cases with pregnant women. We don't have preventive measures. The treatment for the pregnant women is not a strategy implemented here because our incidence is not necessary. We have our malaria specifically at men of the community over 25 years old. Thank you so much. Now move forward to another question because questions are arriving. So to understand the situation in Cape Verde. I have a question asking, Dr. Adilson, thank you so much for your presentation. Would you be able to share with us if it has been any change in the some behaviors in terms of communication with the SBC program when the country was getting closer to the malaria-free certification? I'm reading the question in a different language, actually. No, yeah, well, thank you. We had several adaptations. As I said, our epidemic, it was in 2017, and after that, we had to review all our interventions, also review the strategic plan, create a new one with our focus of the elimination. In terms of communication with the community, we focus mainly on communities, was non-national level. And the last malaria cases that we had most recent in last 35 years, we only had local cases in the capital, Praia, in the island of Boa Vista, very touristic island. Those 2 cities island Boa Vistas and Praia, we had to review our intervention and empower the communities working together with them, especially with the migrant community. Because we know there's a lot of migration in Africa, and when we evaluate our profile, we have cases that happen more in the south in July, and the peak is mainly in October, decreasing starting in December. So the first semester we have very, very few cases, meaning that we don't have parasites in the country. And then later on, we have the imported cases, which is mainly local. And our focus has been specific in these communities. And also where we know there is a larger concentration of the migrant community, and trying to empower that population, showing the relevance to the treatment of malaria-free, which is free for the country, free for all patients, so that the migrant community could also help us to maintain our status of eliminations. And we all will gain with that in terms of economic, socioeconomic development, touristic development. A lot of people come here because of our tourism sector, and we want all of us to contribute to our status now. Thank you again. Move forward to the other question that says, Dr. Dilson, you mentioned in the beginning of presentation engagement of the schools. Could you explain a little bit more how was the process and were the challenges that we face, and also positive experience that other countries could replicate in terms of this approach? In terms of education, Cape Verde, for a very few years, we created some structure in some schools, so information sectors, if you will, which was in the acronym in English was IOF, where we had a council with psychologists. There will debate the issues about health, and then they can later on disseminate the information. One component that we said was the question about malaria and other diseases. And we also have school manuals, information about malaria could be easily treated in the schools. Elementary schools, what we've been doing with all the cabinets that we have, with the help with the Minister of Health, there is a strong communication approach. We created informational documents that are shared in this elementary school through the children, and also through our, you can see on YouTube, everything adapt to the children with a very, very easy language that could be assimilated and put in practice. We will later analyze some of the studies with children, but also information they'll get to the parents through the children. And we know that the children get a lot of information through their own children that go through this elementary school. And we can also identify the areas where they can have the mosquitoes zones. So the impact is quite positive. When we talk about malaria, we need to take in consideration all factors, not only education for malaria, but it's education as a whole, it's the country. Because in general, when we talk about malaria, malaria is very linked to poverty. And when you talk about poverty, we have to consider education, socioeconomic factors. And in Cape Verde, the fact that we have been developed quite well in terms that we said, so the literacy rate in Cape Verde, the third, it's free for all children. It's mandatory all the third middle school or high school. So all population have access to education. That's the reason why we're able to achieve good results that help us quite a lot. Thank you. Your answer is very inspiring to all of us. We had another question for Dr. Giselle, but I would like to send a virtual Hug, I know you are following us in Angola. So the question is, how Cape Verde deal and still deals with the influence of traditional medicine with the SBC strategy? What was your experience with the traditional medicine? Well, I would say that we not has a really strong participation in Cape Verde. When we talk about that with the history of our Lusophone countries in Africa, in Cape Verde is already different because we were developed from the African slaves with the Portuguese. So the first Cape Verde is from a slave and a Portuguese. That was very European education. So the Cape Verde culture was very diluted here. So medicine tradition didn't have a lot of influence because since the beginning, the Portuguese, during colonization, they created the schools, elementary, middle, and high schools. So we have some practices of using some healing plants for treatment. This is very of low use in the country. We don't have the traditional healers. It's very different when we don't have the medical leaders. No, the traditional medicine, although in the Ministry of Health we have a department for that, but specifically for malaria, traditional medicine is not very strong in our reality. Our next question, thank you for your answer. It's a question that comes from Justina, that's asking, which are the measures utilized for reduction for maternal and neonatal death? Because Angola, in our case, we are an endemic country. Well, as I said before, we have to consider the reality of the whole country, development, education factors. Here again, in Cape Verde, 90% of the population is really close, less than 30 minutes to a health clinic, a health center, and even hospitals, regional and central hospital. So we have a reference system of all health. So any patients can easily access a health center. So there is access. They can go to a hospital, and everybody will go there. It will be treated, and so the waiting time is very reduced as well. So which means that us here in Cape Verde, when we consider the indicators in terms of death, mortality for mothers and newborns is very, very low. And based on the data that we have noticed, we have other reasons, other complications, but the fact that we are islands, in certain situations, we might have issues in terms of evacuation. So we can imagine that we don't have flights only 2 or 3 times a year. If we have a maternal emergency, it's not always easy to transport that patient. We had already faced situation that the mom died because of that, because of transport. But however, related to malaria, we don't have that. We are offering the best answer, and if we include the mortality rate for maternal and newborn rates is very, very reduced. It's not only for the malaria. We can say in general, we have data quite interest regarding this situation. We have a lot of questions arriving. We have another question for you, Dr. Adilson that it's in English, and is asking if you could elaborate a little bit more about how's the implementation of the campaign Malaria Free starts, Malaria Zero, Zero Malaria starts with me. Well, that's a campaign we've been very much engaged with our partners. We started this campaign in 2022 with April 25th. We was launched here in Praia, the capital, with the Prime Minister. Our president was someone that started with the process for elimination of malaria when he was prime minister. So he has also been very much engaged. So Malaria Zero starts with me. We launched this in 2022. Currently, we have several partners. We are islands and municipalities at the same time. We share the campaign with all municipalities where we have a small groups and teams working several schools and community areas. And we are also able to have the engagement of the academic sector and the schools that are part of this program. And we go a lot to the university to share what our experience in terms of the malaria-free program. And we have a program that is integrated with not only malaria, but with other diseases, including dengue, and we share this information in a more transactional, transversal manner. I believe you already answer, but Dr. Mario is asking us that he would like to know if for easy to get the political commitment in Cape Verde. Well, at political level, how could I say, we don't have a lot of bureaucracy. Anyone that comes to Cape Verde and goes to a restaurant, have a coffee, you might meet the ministers, the president, you go to the grocery store and you can meet our official authorities, the political authorities. I can go directly to the Minister of Health. So we have this easy access, if you will, and we don't face a lot of obstacles to achieve or to get closer to the official political authorities. And the last ministers that we had have been very much engaged with the cause of malaria elimination. We also in Cape Verde co-chaired that initiative in our Ministry of Health that we was spearheading that. And I would say Dr. Antonio and myself, who are the coordinations, I'm responsible for the Global Fund. We work together. So it's been easy, I would say, when we had a major political and political will as well. Since 2017, we duplicated the financing for malaria. As a financial part, we only have Global Fund that supports us in terms of 30-40% in WHO, later on with technical consultation, but all the finance, all the political engagement is really done by the government. Everything that is implementation of the activities, the transportation, distribution, dissemination, campaigns, everything is supported and provided by the government. Thank you so much. We are getting close to our time. I will ask the last question. We still have a lot of questions. I will ask you to get in touch with us so we can send your questions to Dr. Adilson. The last question that we have here is the following. It was clear for us to see in your presentation the efforts and the commitment to achieve the elimination. This will continue to be the communication campaign, how Cape Verde is continued to maintain the engagement of the population to maintain their certification malaria-free. I would like to say that Susie has my email. You can also get close to me through social media. Later on, you can send your questions that I can answer later on. Cape Verde was able to eliminate malaria, but we had experience from the past because we are not able to achieve the malaria zero, and then we know the malaria, it's a disease that we know continues to be a priority and the main concern of the country. How to maintain the population engaged? It's not easy because we know the African population will only react when we have very serious and problematic situation. It's not very easy to engage a population when nothing is happening, right? So even for us, from the Ministry of Health, it's one thing when the population detects the disease and we what we have to do is to confirm there is no disease, to ensure that we have a surveillance system that we're showing and monitoring that we are doing, and it's very costly to do that. How do we do that? We engage in the population with immunization, engage in our partners, showing the population, which is the gain for all of us to maintain the malaria-free status, and showing what Cape Verde is doing in terms of touristic development. 2026, we want to have 1 million tourists. We are able to achieve that in 2024, which shows that tourism is growing in Cape Verde. Our new strategy to mobilize the population, that they will know and be part of all the gains. Because, for instance, in the capital, Praia, where it had malaria in the past, and now we are very happy to show that these zones which had problems in the past, they are reference areas now. And we show that we had Santo Tomé and Príncipe who came, Ghana who also came, and we show them to know our reality. That's the strategy that we'd like to share, to engage with the population, to show that the gains not only for the government, it's for the whole population. And we created with our national health institutions, which are our stewards of the health, that shows that everything that is not going well will show, and then we go on and we'll do monitor to see what is happening. So we have the population totally engaged. Thank you so much. I'd like to appreciate all the working group to share the experience, especially Dr. Adilson, with our answers to our questions, helping us to understand how the SBC helped in the efforts for malaria-free certification that Cape Verde was able to achieve. Thank you so much. My email, it's already on the chat. If anyone has any question that I would like to ask, please feel free. We are here to share our experience, anything that it's be helpful to share and be replicated in another country. Thank you. Thank you so much on behalf of my country, Cape Verde. So we are now almost getting to the end of our call today. We thank you for the participation in our last general call of this year. We'd like to ask you all to please keep in touch with the SBC working group, sharing what will be on the screen, so you can go to our site, also part of our email list, and also join our Springboard community. So I would just like to say again, thank you so much, everyone, and say that the steer committee We would love to see you all at annual meeting in September in Nairobi. Thank you so much, everyone.